This talk is on my perspectives growing up with KT, and kind of different ways that it's affected me and things I've learned from it. And I'm going to talk about a bit of my background, just personally, with my career, and then with my life with Gratefulness and some of the major setbacks, events, and then get on to kind of a lot of just storytelling and things I've learned from it, and with kind of three main themes here: handling uncertainty, moving, grooving, and goofing, and giving and receiving. But before I get into all of that, I want to acknowledge just how grateful I am to be standing in front of all of you. You make this group happen. It's been many years since I've been here, and so many of you I don't know. Some of you I met in clinic this last week, either as one of your doctors or I was kind of lurking in the background because I wasn't your direct doctor, but I was there. And there are probably some of you who remember me from when I was this big. And so please come talk to me. I want to meet as many of you as I can this in the next day and a half and learn your perspectives, because that's what I'm most excited for. Gratefulness is such an incredibly diverse condition, and you bring so much life experience, and people come from all walks of life to this meeting. I know we have a lot of adults, younger people, kids, and I think also some parents maybe of newborns who are just facing this newly. And so I'll try to make this talk interesting for all of you, but I'm also just excited to meet you and grateful for you. So I grew up in Eau Claire, Wisconsin, and I ended up going to St. Olaf College here in Minnesota, and then I spent a year in Cleveland, and then went to the University of Wisconsin for medical school. I ended up choosing dermatology for my specialty and did residency at UC San Diego, so then I spent a few years out in California. And then a year ago, I came here to Mayo, and as Mega said, I spent a year on staff seeing patients as an adult medical dermatologist. And then the best part of the whole track so far is this year that I've started now getting more specialized training in pediatric dermatology, including, importantly, vascular malformations. And then just to introduce the most important people in my life, three of them are here. My mom, Anne, my dad, Steve, and my sister, Claire, and her big baby. That's not another sibling I have. And then my wife, Roxy, and we just got married a month ago, so it's very fun, strange, and extremely fun and exciting to call her my wife. But yeah, thank you. She unfortunately is in California this weekend, but yes, I'm very grateful for her. So kind of starting then, going back to the beginning, my life with KT. So I was diagnosed shortly after birth clinically, and I'll show you another picture momentarily of what that looked like, but it affects my right leg. And so my trajectory and kind of setbacks and complications with KT have been mostly in the orthopedic realm, which I know is true for some of you and not for others. My right lower leg had a few orthopedic setbacks in the first 9-10 years of life, couple of fractures and big hip surgery that you see on the left there with a body cast, and then ultimately the venous anomalies eroded the knee joints so severely to the point where once I was about 9-10 years old, I lost range of motion, and it became more and more painful to the point where I couldn't walk on it. I spent some time on crutches, and then we made the tough decision to amputate right through the knee, above the knee. And then did pretty well thereafter, but in high school I had two surgeries to debulk some of the lymphatic tissue in my pelvis. And then college and medical school, that sort of era of my life was a lot of right hip issues. So a couple of fractures, a couple of hip infections, reconstructions, and then ultimately that hip was replaced. And then there was also an episode of cellulitis in my skin that then turned into a septic infection. So I was in the hospital for a while for that. And then the right hip, my KT hip has actually been really stable for the last, I guess, 5-6 years. But in residency, my left hip, which is not theoretically not affected by clipple tronani, started to have issues. I had a major infection that the bone became infected, and they had to replace the hip. And then I got infected 4 more times over the next couple of years of residency, 8 surgeries later, many revisions to the hip, some time in a wheelchair. And that all, I've been really stable since in the last year and a half. But the orthopedic setbacks have kind of been all throughout life. So first theme I wanted to talk about was handling uncertainty. I think that this condition involves a lot of different types of uncertainty. And the first big one was really for my parents. When I was born, this is me, and you can see that right leg. They were told this diagnosis, and 32 years ago there was so much we didn't know that we do now. But as many of you have maybe been through, parents and caregivers, it's scary. You don't know what that child's life is going to be like. You don't know if they're going to be able to walk, if they're going to be in pain, if they're going to be able to be happy functioning members of society. And so that was the first source of uncertainty. And I want to acknowledge that that's not just for patients, but it's for all of you who are the supporters in the family and the parents. And then the next form of uncertainty that we faced was then just as the setbacks came, what was going to happen. And the biggest one, of course, for me being the amputation. So I had that done here, and I had all my care done here basically until I started moving away for things at Mayo into adulthood. And Dr. Bill Shaughnessy, who some of you may have seen, did my amputation. He's been working here for over 30 years and saw me as a little kid, and now I have the pleasure of being able to work with him. But, I still remember that appointment with him where my knee had bent up and I was in incredible pain. I was on opioids. And, we kind of went through what were the options at this point. Physical therapy wasn't working. These kind of torture devices, as my mom called them, contraptions to try to gently straighten my knee and keep that mobility that I wore overnight, that wasn't working. And so we talked about, do we fuse the knee straight or do we amputate? And it was really incredibly hard for my parents and, making that decision as I was 10. But I had a little bit of a role in that as well. And I know that orthopedics may not be the issue for a lot of you, but I can imagine that a lot of you have faced very difficult decisions when it comes to, there's a new medication now, there's sclerotherapy, procedures and therapies that have risks, and going into that, a lot of uncertainty as to, is it worth it? Is it going to help or not? And that you don't maybe know a lot of people, even knowing a lot of people here, everyone's story is different. So you just don't know how it's going to affect you. And that's very hard, I think, with this condition. Another form of uncertainty is just the fact that the diagnoses of vascular malformations have evolved so much in the last few decades with our greater understanding of the genetic underpinnings. But that brings a lot of uncertainty when you've been labeled as something for a long time, and maybe now we have new information. And you see a doctor that says, well, maybe clipple tronani isn't the best label for this, or maybe actually, we are thinking this could be kind of in another realm where you might have other risks. We need to image your brain and your spine, etc. And that became relevant for me when I actually was interviewing for residency. And this is my neck on the left side. This, first of all, as an aside, was misdiagnosed in high school by a couple of friends who thought it was a hickey. I was not that cool, unfortunately. But back in 2019, I was on the residency interview trail, and between interviews on a residency interview day, I met a doctor who astutely looked at me. I told him I had clipple tronani, and he's a pediatric dermatologist, and he saw that I had several of these, a few on the wrists and other areas of my body, and he said, this might not be the right timing, but I don't know that you have clipple tronani syndrome for sure. And then I went and did more interviews and cried a little bit. And then he called me after, and he's an incredibly smart, nice man. But it kind of turned my life upside down. And maybe some of you have been through similar experiences where something you identify strongly with is kind of thrown into question a little bit. And then lastly, the idea of KT being a syndrome that is, mosaic to a certain part of the body. It affects your leg, your arm, or whatever. It's due to mutations in that area, but not in the rest of the body. So the rest of your body, whatever might be going on, it's not due to KT, or you don't have to worry about the rest of your body. And I kind of had that view of my condition until maybe the last 5 years when everything blew up for my other hip. And I started to realize, crap, I don't know how the rest of my body is going to fare with this over the next 20, 40, 60 years of my life. Will I keep getting hip infections? Will I eventually not be able to walk again? Will this impact my ability to be a doctor and to work? And I'd say of all these uncertainties, this has been the one that's been the hardest for me and continues to be. But there have been a couple of things in my family has turned to handle this uncertainty. One is to just trust in your resilience. And what I mean by that is, for my family, when they're making the amputation decision for me, trusting that I'd already been through so much, they had been through so much, and whatever this amputation brought, it was going to be okay. And it was more than okay. Amputation was the best thing besides marrying Roxy. The best thing that's ever happened to me. My dad, tells me that it lifted a blanket off my personality. And I take that into every setback or the idea of possible setbacks in the future with my clipal traumatic, knowing that we got through that, we're going to get through the next thing. And I say we because the other part of this is investing in relationships. This guy with me on the right there is my brother-in-law, Austin, and he's not that much taller than me. I'm in a wheelchair. And that day, we had planned this trip up to Big Sur, California. There was a wedding, and we also wanted to do the whole Big Sur and hike and everything. And then I had this setback, and he pushed me miles that day. It didn't matter. And he wasn't even my brother-in-law yet, but he is someone I think of as part of that core group of people that they are the certainty when everything else seems uncertain. So I know you can probably think of who those people are in your life and that you've invested in those relationships, and it's kept the ship on track. And I just I find that is huge for me, for what it's worth. Next theme, movin', groovin', and goofin'. So this each has its sub theme here. First, movin'. So this photo deserves a whole slide of its own. Not just because I was an extremely charismatic child, but some of you may recognize this man. He is Casey Martin, and he is a former professional golfer with clipal traumatic syndrome, now the head coach at Oregon, and a very successful head coach at that. They won the national championship. He was a hero for me growing up. Golf was big in my family already, and then we found out that this guy has clipal traumatic syndrome. He sued the PGA so that he could use a golf cart because there was no way, and he won. Yes. And I still get chills thinking about it. And despite the look of this photo, I was so excited to meet him. Claire and Lisa smiling for the photo. But what Casey did for me is he showed me that it was possible and it was cool to push my limits with, moving my body. And so I started to really move. And, on the left here, it looks like I ran very smoothly, but it wasn't like this kind of Baywatch thing at all. It was like a half waddle, half skip thing. But I didn't care because I didn't care what other kids thought about how I ran, thinking about Casey Martin, And then in the middle here is a very unique experience I had. This is a speed jump rope competition. The West Central Wisconsin, if you're from there, is they call themselves kind of the capital of the world of speed jump roping. And the different schools would send kids to this competition, and I wasn't really competing to win this thing. But basically, you get a jump rope, and in 10 seconds, you just jump rope as many times as you could. And I worked so hard on this. And this, by the way, was months after my amputation. And I had 40 jumps in 10 seconds. And I might have some hip problems from that now, but it definitely was a huge milestone and highlight for me growing up. And then on the right here is downhill skiing. And I'm so grateful to this organization. The Shriners Children's Hospital puts on this Camp Achieve. This is through the Twin Cities. And it's a camp for kids with amputations. And they fit me with these outriggers so that I could ski on one leg. And this is where I really felt like I got to move fast for the first time as a kid. I couldn't bike, I couldn't run fast. And so I found these really creative ways to move, and that got me through a lot of childhood. Now, as I got older, in the last 5-10 years, none of these activities are really safe for me to do anymore because of all the hip setbacks. I do... Mom, cover your ears. I hop around the house sometimes a little, and I can't find my crutches. But otherwise, I don't do any of this stuff. And I've gotten kind of down with that, thinking about I'm slowly losing my mobility. And it's kind of required a change of perspective for me that maybe I'm not losing my mobility, but my ways of moving can change, and I can learn new ways to move. And so I did. And I obviously golf because of Casey. I love to golf. I golf horribly, but I did have one hole-in-one, so that's the photo you're going to see. And then Roxy bought me this bike a couple of years back that's arm-powered. I'd never been able to ride a bike before. So I realized that in adulthood, maybe I'm not losing mobility. It's not changing. I'm actually gaining new ways to move, and that's helped a lot. And we loved the great outdoors and camping, and that's just another way that I've found I can move and enjoy it. Now, this is the Groovin section. Music has been enormous in my life, and very largely because of the man in these two left photos, my dad, Steve, who is an incredibly talented and passionate musician, singer, guitarist, mandolin player, piano player, violinist. He did that for a while with me, although I was a little bit better at violin than he was. And this was huge for me because I felt like, where a lot of kids were excelling in athletics and other things that were harder for me, I could excel in music and I could really exercise this passion. And I'm excited to get to know you all and know what your passions are. I'm always interested in learning new things and creative ways to express myself. And it got me through a lot of pain, especially when I think about this middle photo, which was The Music Man. If you're familiar, it's a musical theater show starring Harold Hill, my dad played, and then Winthrop is kind of the child lead of the show, and we got to do that together. And this was kind of key for me because it was actually those 4 shows were the last 4 days that I walked on my leg before the amputation that I had months later. I was in so much pain, but it somehow, being on stage and the joy I got from that got me through that, and it continues to this day. Singing, playing guitar, etc., expressing myself helps with pain. And then lastly here is the Goofin section. So I don't have a lot to say about this. Kind of speaks for itself, but I've found that making the most of my physical situation, especially in October, is very fun. So the left, you might recognize the Iron Throne there. I was Lord Peter Baelish, Littlefinger, and Roxy Osanza. And then on the right, if you are familiar with The Christmas Story, I was the leg lamp. So finally, this last theme here is giving and receiving. I bring this up because I think kind of getting into medicine and having that passion because of all of the medical care I'd had, I always felt like I'm a giver, but I've had a hard time with receiving. And I think that's true for a lot of patients with Klippel Trenaunay because we learn to be so independent and to adapt, and it kind of creates a natural instinct to want to do that for others, inspire others, help others, care for others. But I had a hard time for a while in medicine with certain situations, like when I'd walk into an exam room, either on crutches if I wasn't wearing my leg, or with a limp if I am wearing my leg, and the kind of immediate reaction of the patient is sympathy, or like, oh, what happened, or and I hated that because it was like, I'm here to care for you, and I don't want to focus on that. But that's kind of changed, and I think when that changed was when I had the biggest left hip infection setback. And when that happened, I was in the hospital for like a month, and I was in a wheelchair for like 3-4 months. And Roxy and I at the time had been dating for all of 6 months. When I got out of the hospital, I had to move because I had chosen to live in an apartment on the 3rd floor without an elevator, which don't ask me why I did that. But she moved me, and then she moved in with me, and she cared for me every day, and on top of her full-time job. And it was, honestly, I was a really kind of crappy person to work with because I couldn't accept this loss of independence. And it took a long time for me to be gracious about how incredible her care for me was and to become a better receiver. And then when I did go back to clinic, I was in a wheelchair for maybe 6 weeks or so in clinic. And so that was challenging, but I found that I approached it in a totally new way in terms of my interactions with patients. I let them open the door for me. I tried to be more gracious about just kind of explaining my physical situation with them because I realized that being vulnerable with them really helped me kind of meet them in their vulnerability. And so I imagine that's true for all of you and in your work, in your personal relationships. The more vulnerable you are, the more vulnerable people will be with you, and it really enriches those interactions. And finally, I just wanted to mention this woman on the right. Her name is Dr. Sue Boyko, and she is a retired pediatric dermatologist, but anything but retired, because she has this enormous passion for serving her community. So she spends many hours every week organizing and leading free clinics for skin cancer screenings for people without health insurance. She volunteers heavily in this Camp Discovery for kids with severe skin diseases, a summer camp, and she's starting her own installment of that next summer in California, which she's recruited me, and I'm going to be the music director which I'm excited for. I need to learn to play guitar a little better. But she's my role model for someone who just actively exercises her passion for caring for people in every facet of her life and in every stage of her life. She's just incredible. And I think that we meet each other in a lot of different stages of our lives and in our journey with Kilpul-Trinane. And a big thing I love about this conference and this group is that we are role models for each other. It goes both ways. And I'm so excited to meet you all, learn your stories, and I think that there's such an enormous capacity for us to care for each other through this meeting and this group. So that is all I have. But I wanted to thank a few people. First of all, obviously my family, my certainty, Mom, Dad, Claire, who've been through all of this my whole life and will continue to. Thank you for being here. All the Mayo doctors here, including most of the pediatric dermatology group pictured here, who welcomed me into their family or training me, as well as all of our colleagues who see these Kilpul-Trinane patients and are just amazing role models to me too. I look forward to getting to know you better. Thank you to Melanie for inviting me to do this and for organizing this group. I just want to give you thank you. Yeah. And again, just to all of you, without you, there'd be no KT support group. So that's all I have. Thank you for listening.